Kyli Moore. Welfare's purpose should be to eliminate, as far as possible, the need for its owning systems, once stated by Ronald Reagan. Most of our parents have been drug tested in order to have a job. Should it not be the same for people receiving free money and food assistance? The Minnesota Family Investment Program should drug test all welfare recipients before allowing them benefits. First, I will tell you what the Minnesota Family Investment Program is, then how the MFIP is being abused daily, and finally how drug testing can improve the way welfare works. In order to understand the problems of the Minnesota Family Investment Program, you need to know what it is. According to Minnesota Family Investment Program of Minnesota Department of Human Services on November 17, 2016, they stated the Minnesota Family Investment Program is the state's welfare reform program for low-income families with children. It helps families with children meet their basic needs while helping parents move to financial stability through work. Parents are expected to work and are supported with free cash and food assistance. In order to be eligible for the MFIP, you must meet general requirements. According to Your Path to Government Benefits of Minnesota Family Investment Program, these requirements include being a Minnesota resident, you must be pregnant or caring for a child under the age of 19, either a U.S. citizen or have qualified non-citizen immigration status, have low or very low income, be underemployed, working at a very low wage, or be unemployed, and meet program set limits. After you meet these requirements, next is the application and program contact information. You must fill out the application and file it with your local county human services agency. Being allowed benefits on the Minnesota Family Investment Program can also create problems. The MFIP is being abused daily. According to John Morgenstern and Kimberly Blanchard, Turning Discovery into Health, National Institute of Health, U.S. Department of Health, and Human Services, recent studies have shown the use of alcohol and drugs have gone up in the last year. Welfare is giving recipients free money benefits. The recipients can either spend this money on their everyday needs, or they can spend this money on drugs. Also described by John Morgenstern and Kimberly Blanchard, Turning Discovery into Health, National Institute of Health, U.S. Department of Health, and Human Services, more important studies have shown that people who have abused the system have chronic substance abuse while being on the Minnesota Family Investment Program. It affects the recipients along with taxpayers. Abusing the Minnesota Family Investment Program creates money problems, but can also result in death. First, taxpayer money is going up. According to A Guide to Political Left, Discover the Networks, in November 2012, they stated in the U.S. Today, the total spending on means-tested welfare program amounted to $956 billion per year. This figure is an increase of 32% over the level of welfare that took place at the beginning of the Obama presidency. On average, a federal income taxpayer in America spends around $9,000 annually to keep federal welfare programs afloat. Recipients are also dying of drug overdoses. According to Illicit Drug Overdose Drug Policy in July 2016, average weekly deaths due to illicit drug overdose is 40% higher during weeks of income payment compared to weeks without. They also estimated that 77 deaths could have been avoided due to income payment. After hearing about what problems come with the Minnesota Family Investment Program, I can now tell you how drug testing can improve the way the system works. The MFIP will drug test the recipients. The Minnesota Family Investment Program will take action against recipients who abuse the system. The MFIP will give self-reported surveys. Further interviews and screening methods will take place regarding the surveys. The recipients who abuse the system will get caught and will no longer be given free benefits. Drug testing recipients is both logical and reasonable for recipients and non-recipients. 15 states already drug test their welfare recipients. According to Legislature's National Conference of State, drug testing for welfare recipients and public assistance, these states include Alabama, Arkansas, Arizona, Florida, Georgia, Kansas, Mississippi, Michigan, Missouri, North Carolina, Oklahoma, Tennessee, Utah, West Virginia, and Wisconsin. The number of recipients receiving free benefits will go down. The public will no longer have to pay for recipients who abuse the system. The public will also agree with this change because they are paying for less recipients and less benefits. In conclusion, on first, what the Minnesota Family Investment Program is, then how the MFIP is being abused daily, and finally how drug testing can improve the way welfare works. The Minnesota Family Investment Program should drug test all welfare recipients before allowing them benefits. If we implement Ronald Reagan's dream, we will eliminate welfare altogether.